Good day, this is Professor Will, CBMD PhD. Today's Monday, October 25th, 2021. It is 3:35 and 9 seconds p.m. Eastern Standard Time. Today's research, leukemia. So let's hop to it here. The treatment enhances anti-leukemia effect of bone marrow transplant, reduces reoccurrence. Study finds. Date October 20th, 2021. Source, Michigan Medicine, University of Michigan. Researchers have identified a drug that, when given along with a bone marrow transplant, drops the risk of leukemia reoccurring by 20% among the high-risk patients. Researchers looked at patients with an advanced form of acute myeloid leukemia that had grown resistant to other treatments. And their next step was a bone marrow transplant from a donor, a procedure that is sometimes not recommended because the patients are so sick. It is a risk option, even with a transplant. 60% of patients relapse within 6 months. The researchers suggested the drug interferon could enhance function of a key subset of dendritic cells that can selectively enhance T cells, which recognize and kill leukemia cells after treatment. Interferon alpha is used in some autoimmune diseases, but the response does not last long. And to get around that, researchers looked at a long-acting form of interferon called pegylated IFN alpha. It is commercially available to treat hepatitis B and C, as well as some blood cancers. An early-stage clinical trial enrolled 36 patients who received 4 doses of pegylated IFN alpha every 14 days, beginning just before their transplant. At 6 months, 39% of patients had relapsed, reducing the disease relapse by over 20%. The drug was generally well tolerated, with side effects, in line with what many transplant patients experience. Moreover, the interferon treatment did not appear to increase graft versus host disease. Despite the curative potential of bone marrow transplant, relapse remains the greatest barrier to successful outcomes. This suggests that a brief course of pegylated IFN may increase the anti-leukemia potency of an allogeneic transplant. And if this intervention can reduce relapse, even by 10 to 20%, it can translate into improved survival. While more research is needed to confirm the findings in a larger randomized clinical trial, the researchers note that new strategies are essential for this group of patients who have few options. It is not a home run. Researchers move the bar up, but it is not high enough. They need to determine what else they can do in addition to interferon to get those patients who still relapsed. The research team has some ideas, based on ongoing laboratory research, to try to improve upon these results. In addition, they are looking to perform a randomized trial, potentially also exploring interferon in other types of transplants or blood cancers. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.